Hello. So I wanted to take a bit of time just to talk about this week's material specifically around evaluating public policy, health impact assessments, and logic models. So the last couple of weeks we've explored how policies have the potential to influence health, and we'll continue to discuss the influence of the environment. However, our understandings are mainly theoretical, so we know that many policies could influence health, and help to reduce health inequities, but do they? Or do they actually improve health among some groups or populations and make things worse for others? So analysis and evaluation are really two tools that we have to get a better sense of the impact of particular policies. So most of the time, policy analysis or evaluation is really done after a policy has been implemented, in part to see whether the policy has achieved its desired effects or to identify any unintended consequences of the policy. So sometimes, and this is really the ideal case, that the evaluation process is really integrated into the development of the policy right from the beginning. So policy analysis really determines which policies will most achieve a given set of goals. And policy analysis can be done with a certain lens, kind of like gender analysis or analysis as it relates to Indigenous populations, or it can be done from a more general framework. So as you will see with health impact assessments, equity considerations are increasingly seen as a really important component of policy analysis and evaluation. So a health impact assessment is really a combination of procedures, methods, tools that really allow for a strategic evaluation and assessment of the health and social impacts of a policy or plan, or even a project. So health impact assessments really provide information to decision makers and stakeholders about the intended and unintended consequences of putting this policy into place, so an activity or a program, and really makes recommendations to maximize positive and really mitigate negative health impacts for the affected populations. So this week we're really going to talk about a general approach to policy analysis and evaluation and really identify some of the underlying factors involved in policy change. So we're going to learn about some tools that can be used in policy analysis and evaluation, and then you're going to use those tools in assignment number 2. And we also examine kind of an overall approach to health impact assessments, so including health equity focused impact assessments and the tools, resources, and methodologies that are used. So really most, if not all, public policies do have actual health impacts. The concept of healthy public policy really requires that those impacts be understood, they be assessed both proactively in the development, but also retroactively when we evaluate public policy. So health impact assessments is really the process by which these assessments or evaluations are made. So health impact assessment is really defined as a combination of procedures, methods, and tools by which a policy, a program, or like a project, I guess, can be judged or evaluated based on its potential effects of health on a specific population. So essentially, health impact assessment process really is a series of questions for discussion through a combination of these tools and methods that allow for that evaluation and assessment of the health or social impacts of this piece of work. So the questions in a health impact assessment are really designed to provide information to policymakers, decision makers, stakeholders, and sometimes the general public are included about the intended and unintended consequences. So it really helps people look at health policies in a new way. And really see how those pieces, can be interpreted and can really be impactful. So health impact assessment is really this way of bridging a gap about thinking about how policies, say in transportation, influence people's health. And health impact assessment is this process that makes it possible to kind of shed a light on those decision makings related to proposed or established policies and their effects on health. So there are really many approaches to doing a health impact assessment, and the oldest is really developed within the field of environmental health in relation to the environmental impact of a development project on health. And it's most frequently used to assess proposals that are kind of outside the traditional healthcare sector. So we think about estimating the possible effects of health and well-being, and minimizing the negative effects. So thinking about transportation or logging or building, and all of housing and all of those pieces that are traditionally outside the healthcare sector, and thinking about their impact on health. And different countries process or have different health impact assessment processes. So thinking about in Canada, we've been really slow to explore health impact assessments over the years. They're not currently required by legislation, but the federal environmental impact assessment and provincial environmental assessments are really required for legislation for some projects. So thinking about, environmental assessments, community health assessments, cost-benefit analysis, those pieces are required. And they do need to consider this intended and unintended consequences of health determinants and really specific health-related outcomes. So Ontario and Quebec were really the first to implement these health impact assessments. BC really in the early 90s kind of started to get involved with it, and then they subsequently abandoned it. So we really want to think about health impact assessments and really assisting people to think about, as public health practitioners, we want to know, what is a health impact assessment? Why is it useful? What are the steps and what are the tools that are necessary to conduct a health impact assessment, including logic models, which are presented in your course notes this week. And we also want to think about examples of how health impact assessments can influence the project outcome. So those are kind of the general goals for this week. And there are lots of resources posted this week because this is very important for assignment number 2. So I'm hoping this will help create some context and help you get started thinking about what you want to look at for assignment number 2. So this week's discussion activity really focusing on a case study of implementing these health impact assessments.